So we moved into the treatment area here, and this is a great facility. It's got 5 medically rated dive chambers here. I'm going to let Janine tell you a little bit about why this is so unique.
So we have some of the largest single occupancy chambers in Northern California, and we have a very specialized gas system. We don't recycle our oxygen in between chambers. Each chamber has its own inlet and its own exhaust, and all our piping is done by breathable gas plumbers that are using silver to actually solder the piping. So this is all silver soldered and not lead soldered.
So that's one of the important things for people that are doing several treatments in a row, having the highest quality oxygen to breathe and making sure that that treatment is 100% effective and safe.
Absolutely. We want our patients to have the best possible outcome that they could have in advanced healing. And another thing is that all our gas comes with MSDS listing, testing for purity, and that's really important to us. We also have 5 points of regulation to make sure that each chamber has the right amount of pressure going to it at all times.
And I think one of the cool things you told me is that because people can be a little claustrophobic, or if you have trouble clearing your ears while you're doing the treatment, there's a little patient-controlled escape hatch, if you will.
Yeah, we have the only chambers in Northern California that actually have an emergency button from the inside that you have a measure of control. No one in 18 years has ever had to use that because there's always multiple people here taking care of you. But it's just nice to know that you have a measure of control, even if you don't have to use it. So what would happen if you push that button is it very slowly stops pressurizing or going to depth, and then it very slowly starts ascending, and that would be taking the pressure off of the chamber, so you could eventually come out.
So one of the other things you can see over top of each of the chambers, there's a little viewing screen. So there's a whole wall of movie choices behind us here.
Yeah.
So I know some people like entertainment. Do some people just like to relax and zen out? Or what do most people do when they're having a treatment?
I think it depends on the patient. Some patients like to listen to music, books on tape. They enjoy watching the movies, but sometimes they'll download something ahead of time. I particularly love listening to positive thinking stuff, anxiety relief, stress relief CDs. You could almost do almost anything in the chamber, but really relaxing and downgrading your brain, especially if you've had a concussion, is very valuable. I call it almost like defragmenting the brain.
Okay.
Some patients say they come up with their $1 million ideas when they're in the hyperbaric chamber because they're able to just really focus.
Okay, well, I'll see if I come up with any $1 million ideas after my treatment. And thank you guys again for hosting this incredible staff. So I'm going to get changed and we'll get started with my treatment.